right? And why is it good for patients to talk about you? Why is that a good thing? Versus you talking about yourself all the time, which is considered conceited, I think. I don't know. Is they're building up your reputation, right? And they may not even know what the adjustment is yet, but they go, I want these results. I want to feel like that. It's not about us, it's about them. So when you think about that, when we backtrack your treatment, your adjustments, your exam, your results, it's about what they want. Sometimes it's headache relief, sometimes less medication, sometimes just pain relief, sometimes just being able to sleep better. And when you do your examination too, do you ever talk about the exam where you see someone's kind of quiet, had been chronic pain, say for 3 months or so or more, and all of a sudden you ask them, well, how do you sleep? And that correlation of, I don't sleep very well. And you kind of dig it down a little bit and go, well, do you wake up tired, drained, just not energized? They go, yeah. Do you go down the rabbit hole and go, well, sometimes do you feel overstressed than you were before you had the pain? They kind of get where I'm going here? When you go there, then you go, yeah, I do sometimes. Then if you're comfortable, ask the question, sometimes you feel anxious for no reason. And they go, sometimes I do. If they do that, sometimes do you feel depressed? So then that gives you the window, I think, for me at least, the ability to go explain the nervous system, fight or flight, stress response. Where are you? Where are you on that scale? This is why your nervous system is off per se. At that point, your body can't reset itself. Can we help reset that for you? And what is it sometimes they'll do if they confirm? How do they confirm that? Will they say, yes, doc, I want that? It's not a revival. But what are they going to do? How can they respond? How would you see it in their expression? They do this. All right? You get simple things, simple body language things. Once you go, yeah, I feel a little anxious. Do you feel that sometimes? They go, yeah, I do. And start doing this more and more, then you got them. Then you got them to realize what they're feeling, maybe not their back pain, but their lack of sleep correlates to the nervous system. Then you link it to them slowly, till you see all those links, the head nod, the confirmation. Go, what else do you feel? How else did it affect you? At going down that road, why is that important to get them to understand the need for the adjustment? Why? Is it an emotional response? And when you have an emotional response, that confirms that they want to do that. This is not just chiropractic, it's everything we have to do to communicate our message to our patients that this is what's going to help them get better. All right? Any questions yet? Comments, concerns? Want more coffee? Who doesn't want more coffee, right? My coffee's in the car, I drank half on the way down. So my thing is, when you have that conversation, it takes 5 minutes. And if you take an x-ray, do an exam, whatever you're going to do, can you get them to using that information to confirm what they're feeling is related to their back and how you're going to fix their back? All right, so this is we see a few people a week, a lot sometimes. This is one of my patients, Brianna. I see her, she works at UPS. We see a lot of UPS patients. They come in probably 3-4 times a month because of their work they do. So they know when they come in, I go, how you doing? Things are good. All right, let's get anything different. Boom, boom, boom. Let's get you adjusted. So this is my quick adjustment. What I do.
Good, right here. Take a deep breath in. All the way out. Let that head drop and shoulder drop a little bit more too. Right. There we go. Good. And then cross your arms showing also. Right here. All right. Take a deep breath in. All the way out. Good. All the way out. One more time. Easy, right? Good. Good on your second side for me. How's the lower back pain?
Good.
Perfect. The leg drop all the way down. Bring that hand up here.
Simple stuff.
All the way out. There we go. Good. Other side for me too. Piece of cake. Right here too. Let that arm come up. Yeah, there you go. The leg drop over too. I like the shoes. Deep breath in. All the way out. Okay. Back workout.
Easy stuff, right? The adjustment doesn't take very long when they understand what it actually is. Right? I've seen her for probably 6 months, 7 months now. A lot of UPS, a lot of just people we see all the time. But when you have that, and we get them to that point, before that, when you see someone for the first time, how do you, before you lie them down, how do you prep them? What's your normal routine? What do you do? I tell them, I'm gonna adjust, if it's back and neck, I'm gonna adjust your full spine. Even if it's just the neck, I kind of want to treat the whole spine because the spine is one system per se. At that point, we move things around together, then your body can actually feel better overall. Simple, right? Easy stuff. I'll go over a couple more things that I do. I did a little talk for one of the attorneys locally who wanted me to do a spiel on back, neck, and mid-back area for one. But you ever talk about your patients, if you could joke with them, especially if you can read the room properly, and they ask you, well, how risky is the adjustment? Is there risk involved? I tell them, if I can joke with them, I have good malpractice, I'm not worried. We'll be fine. Make sense? They go, okay. I go, we've done the exam, we know your history, medically you're fine, you've been checked out before. At that point, let's take care of you now and get things moving. What is a common reaction for the first adjustment? What are the top, say, 3 for you? What do you usually get? Anyone?
Shit.
Like, oh, Tourette's, right? Tourette's are like, what the heck was that? How about laughing, right? People, they laugh all the time. Or sometimes if they have an emotional response too, they cry. And I always tell them this is normal. It's a normal reaction. Because you say like, oh God, why'd you do that? What's gonna happen? If you're freaked out, they're gonna be freaked out. Remember a couple years ago, I had, just a quick side story. I had my water heater go out, right? I'm like, okay, I'll call someone and replace it or check it out. And I tried the YouTube thing, tried to relight it, didn't work. And I called somebody, he goes, man, this is really bad. I go, Mike, why? And this is an older mom and pop guy, comes with an old van. I go, Mike, why? Why is it so bad? Do I have bad plumbing? Do I have to replace all my plumbing? He's like, no, you need a new water heater. Mike, okay, what's gonna cost me? $10,000, $20,000? About $1,200. I'm like, Mike, not a big deal. Yeah, he was more upset about than I was. So almost making it more easy for the patient allows them to also feel ease too. So, and again, new patients are always the ones you want to, for me, I focus, my partner treats everybody, I treat more than new patients, because I want them to have the first experience of understanding what it is and to feel everything. Before you do the adjustment, what's the most common thing they come in with the cause of their pains? What's the non-traumatic cause? What do you think? What's the number one thing that happens? What's the number one? Starts with a P, ends with an E. Posture, right? So when you have someone with a posture issue, I ask them, so you've had this pain, you woke up a couple weeks ago with it maybe, your back started hurting, what kind of work do you do? I sit a lot, all day. During COVID, what happened? People sat forever. So when you have that, I go, okay, if that might be your initial cause, so how do you let them know if their posture might be their issue causing their pain? How would you do that? What do you think? What's a good way to test their posture? Does you ever do this with your patients? Test your posture? Come up for 1 second. Let me use you as my example. My Vanna White, if you guys know who Vanna White was back in the day. Okay, sir. Tony, nice to meet you. Ron, nice to meet you. Take this wall for me, sir. All against the wall, heels against the wall. Hips, shoulders, and head. Hands at your sides. How does that feel?
Feels good. Feels like I'm leaning a little far forward there now.
Mm-hmm. And some people, they have back pain, they're going to go, when I lean back, my back hurts. When I bring my head back, my neck hurts. So I tell them, we're going to help fix that. You know, Ron? And then I always check too, as you guys probably do also, if you think big picture, how's their feet? Are their feet coming out? Or like Ron being the perfect specimen he is has his feet straight. Good. This is just you knowing your body. Thank you, Mr. Ron. I'll call you back in a few minutes. So I usually do that first. And then from there, after I adjust them, no matter where their pains are, I'll always check them again on the wall. How does that help them confirm that this works? Because they'll stand against the wall, and I ask them, once they stand against the wall a second time, I'll ask them, now how does it feel? They go, it feels what? Less soreness, less pain. What else would they sometimes say when they get the result you're looking for? What else can they say? Would they say they feel heavier or lighter? Lighter. relief, less tension. They even say less stress, less pressure, less sciatica. I'll usually, by then I'll go, you know what, it's actually called this. Real education, you know? But that thing is, when you can get people to see the results almost immediately, fantastic. If you don't have that response, what can you say? What do you usually say? It's going to take some time. And you got to prep them too before the adjustment. I always do too. You may feel better, worse, or the same after your first treatment. These are all your options. Because you've had it for so long, this may not be magical. Unlike your friend that came in 3 weeks ago, call her Sarah, and said she had one treatment, she was cured for the rest of her life. I mean, you're not Sarah. You have different problems. So when you get that, again, oh, that makes sense. So you have to give them a good prep time, I think, to understand what's going on. So another one, simple stuff. A lot of my UPS patients, I see a lot of laborers too. Easy stuff. A little bit low on this one. Easy stuff. Anthony. Easy stuff. Easy, right? And you guys do neck adjustments seated? No? For me personally, I find it helps headaches more, gets that suboccipital area moving more for one, too. My lying down is more the lower neck for me. It just helps those headaches, especially if someone had, for example, a car accident, or they had problems with headaches or concussions in the past. So when I see that, a lot of it is, okay, how to release that pressure and move things around more versus just the neck being sore or shoulders being sore. When you hear someone say, I have pain in my shoulders, do you want to make sure you know where that actually is? Is it here? Is it here? Or is it actually here? So what I have my patients do is point on their body or even on my body where the pain is. By doing that, it's very specific, so what they may think is their shoulder is not actually sometimes their shoulder, or their shoulder blade, or their leg, or their low back, or their hip. So I want to make very, very specific when I treat them, point to it for me. What are you looking for? And part of it too is during, as we know with the COVID, we had to wear masks sometimes, is having that visual allows to, if you want to call it, give you an extra confirmation versus the verbal. All right? Any questions so far? Anything? This is kind of just confirmation what you do already, right? When you adjust someone, if someone is kind of tense and won't relax, how do you distract them in a professional way? What do you do? Do you ever have move their feet? Yep, move their feet. How about their hands? Squeeze your hands together sometimes, you know? Obviously breathing, breathe in, breathe out. Do you go, all right, guys, 1, 2, 3, let's go? No, it doesn't work. It might. I think it kind of like goes, okay, I'm ready. No, it doesn't happen that way. So you want to make sure we're doing the right thing for the patient. So the first impression is this is going to give them relief. It's going to be, if you want to call it, easy for them to understand. When I first adjust someone for the first time, and everyone's different, do you put them on their stomach or on their back? What's your preference? On their stomach? Good, good, good. Stomach, back, stomach, stomach. I've changed mine, even though that's more common, on their back, because I want them to see what I'm doing for the first time. So if I do, for example, if I see on the x-rays, if I take the x-rays for that patient, I see a leg inequality, I want them to see that with their legs. I want them to feel what's going on. Looking for scoliosis or a mid-back issue for 1, 2, I'll put them on their stomach afterwards, so now they know what's going on. Because they may go on the table and sometimes put their head over here. Ever have a patient do that? I go, no, let's turn you around a little bit. You know, they just don't know. So when you put them, for me, putting them on their back first allows them to see what I'm doing and then talk to them so they can see me talking to them. So I give them the verbal command and then I turn them over if needed. You know? And you saw my side posture. Next, it's basic chiropractic. There's nothing fancy. You ever have someone call your office and go, I'm seeing a chiropractor, I moved the area, but I want to get this specific technique. Do you have that? Go, what is it? It's called, say, the Volcker technique or something. I go, Volcker technique online. Google it, boom, 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 use Google World Wide Web, and go, this is the chiropractic adjustment, done this way for the general adjustment of adjustments. Okay, perfect. Yeah, I do the Volcker method. Boom, thumbs up, let's go. You know? So when you explain it that way, because sometimes chiropractors have their thing they do, which is fine, but can we make sure they understand chiropractic is chiropractic? Even use an activator, it's still chiropractic. As long as you explain the message properly and get, again, the results, I think that's going to be what's going to make you the chiropractor for that person. Do you have patients that come and see you for a long time, like for years? Maybe just once a week, once every other week, once a month, whatever it is. Why do they keep coming back to see you, think? Think you have good jokes? Want to compare them? But it's almost, they dislike you. Right? I have Marilyn, Robert, and Colleen. They come in once a week. Robert said, because here he has a shoulder surgery. But I called him, I was like, he's doing okay. I go, why do you keep coming in? They go, yes, you have decent jokes, but we just want to see how you're doing. And obviously my back hurts here. I have this going, they're seniors. So they want to come and they want to make sure they're staying healthy. So when you have those, call them followers, whatever, allows you to go, what else can I do to help them get better? Do you ever feel, and I know people do, especially in training, you have to give them more and more and more? You ever feel that? Especially when you're younger, when we were youths back in the day? It's almost like, what else can you give them versus like, just keep them happy where they are. I always tell my patient when I first come in too, I go, wherever you are now, say if they have bad posture or poor posture where it hurts them, let's make your, you ever use this? Let's make your default better. So over time, that becomes more normal to you to feel good. Then from there, you maintain it on your own. Why not? Simple stuff, right? Ever have someone come in with chest pain? First visit, you go, are you in the right place? First question you ask is, have you seen a cardiologist? Have you seen a medical doctor? I'm not a cardiologist. You go, yes, I have. They say, my chest pain is coming from stress. You go, perfect, you're in the right place. How do you correlate that? As we all know, vagus nerve, is it C10 or 10, right? I got it right, perfect, it's so early for me. 10 comes down, affects the systemic system, blah, 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 is what we do. I had someone come in a few years ago, where I live, she drove 2 hours for work every day, City of Commerce, and then back home every day. Would that cause stress? Probably. She was gonna quit her job. I go, this is my last hope. If I can't help me, at that point I'm probably to quit my job and find something local. I'm like, all right, a lot of stress on my end. Perfect, thanks, appreciate it. So I said, let's give you a trial period, 2 to 4 weeks, see how you do. Over that period of time, we added walking at work, which you never did before, eating a little bit better, sitting better for 1, 2, and getting her to change some of her lifestyle besides the adjustments. At that point, what did she do? Able to keep her job. Her stress level went down because she did the things to correct her stress. Some patients, this is 2025, right? People just don't know. You go to a medical doctor, it's not about, let's change your lifestyle. Maybe you should eat this, or maybe go for a walk. It's more of, what meds do you want? So can we adjust their mindset of, how do we take care of their own health? Because I'm not their caregiver, not their whatever it is. I'm here to help guide them in what they need to do. And what I always do now, been in 20 years in practice, I go, you ask me what you want, and I'll help you out. I'm not going to blab all my stuff to you if you're not going to actually take the advice. You know, if someone comes in a couple times, and you give them exercise stretches to do at home, they don't do them. When they come back in, what do you say? I go, if you're not doing your stuff, don't come back in. This is part of your lifestyle now. So when someone has ability to feel the adjustment and get better, I think a lot of it is our responsibility is what got them here, where they had the pain, how do we correct that, remove either the obstruction or add something in so they can actually get better long term. Why do you think that's important? Why would that be important to you as a person? Someone said that, hey, you should probably do this. Why is that important, do you think? Is it something to where you're helping them, again, my long-term patients, because they want to stay healthy? I go, does this feel good to you to be in pain? They go, no. So how to get you out of here so it never happens again? And my thing is, every person is different, right? You're going to treat someone who's, say, 20 years old different than someone who's, say, 60 years old. So can you have, again, as we all have the experience, those files in your head that you can adjust and pull from based on that person, their personality, and also what they do for occupation and just their stress in their life. And I said, I'm not a psychologist, but let's calm down stress in your body so now you can handle the stress of your day. How many you guys have parents bring their kid and go, my kid has bad posture, he's on his phone all day, has tech neck, whatever it's called. At that point, what can we do? I go, we can adjust them, but can we make the muscles stronger so they can handle that stress, whatever it is, the body feels better. You know, going back to concussions too, talking about headaches from before, how do you guys treat concussions? Anybody? Not me directly, just more, say, neck pain, headaches, right? From a car accident trauma. Happens. How do you diagnose that? How would you do that in your own practice? Or tell them to go see the doctor and do this? What would you tell them? What do you think? Go get a barium study? Maybe not. Colonoscopy? Probably not. CT, MRI? Maybe, yeah, right? And I said, I'm not the specialist on that, so here's what you got to do when you talk to your doctor. Or if you're in a PI case, here's your attorney, I'm going to send them something on letterhead saying requesting an MRI for a brain study. And looking at that in detail and going, okay, I need an expert for that. How do I get help understanding what that is? You can do the normal test, ENT test, all the stuff too, all the sensory tests for one also, but still you may miss something. Especially if they've had under your care for say 2-3 weeks, they're not getting better, at least that's my perspective. 2-3 weeks, not getting better, what else, what are we missing here? X-rays weren't enough, let's get an MRI. This is going up, what else can we do? What am I not seeing? Because my biggest thing when I see a patient, I want them to say over time, I'm getting better. Whatever terminology that is for them, I'm getting better. I can do more. I can move around better. I can sleep better. I sometimes joke with my mom patients, are you still grouchy at home? And I go, no, okay, I must be getting better. But my neck still hurts. Yeah, because you're getting better. You're sleeping better. They go, okay. So you got to find ways to get them to confirm what you're helping them with, maybe some not indirectly with their pains, but what they're feeling in their body. All right? Any questions yet? Comments, concerns? You guys tell jokes to your patients? Sometimes? Corny jokes? When I told my patient during the holidays, my wife was sick, she was sick during the holidays. She works for a school district. She's outside walking the dog right now. And she couldn't figure out what it was. So what happens is her doctor calls and goes, I want to do a video conference with you. So you know how the bird flu was going around for a long time? And some people did catch it. So my wife was kind of getting close to that. So did a video conference, and the doctor goes, well, cough for me. So when she coughed, she went, caw, which is what? The bird flu. So just kidding. It's a joke. It's a joke. But can you tell your patients just to have fun with entertaining yourself, hopefully, but also them at the same time? Because that's a good one, doc. I'm like, are you going to share that? Probably not. Thanks. Appreciate it. So, and these are people that you want to have in your practice for a long time, because when you have people that like you like that, what happens? Do you have to market all the time? Nope. They bring their own friends and family that they like in. All right? Next one. This is how I explain my neck, just the neck adjustment, and how it works for someone who's never seen a chiropractor. This is for the attorney. She wanted to do some videos with me.
Hi again, I'm Dr. Tony. This is Naomi. She's going to be my patient today. We're going to explain how the neck and the lower back adjustments go and how they work.
No response.
I explained what our goal here is to make sure you feel comfortable when you come to the chiropractic office, what you should expect. Okay, the adjustment allows the bones to move. You may hear some popping, you may not hear some popping. By that movement, that popping releases pressure. Get the pressure out of your spine, then your body can relax, not only the muscles and joints, but also over time make you want to stay that way. So your person's health improves with chiropractic, that's your overall goal. So I'm going to adjust, I'm going to have you turn around for a second, you're going to turn on this side. I'm going to show you exactly what we're going to adjust in the neck first, have her lie down in a second. Is I'm going to adjust these bones here at the base of the skull down to the shoulders here. Okay, that is your neck. Yes, that bones in your neck to go from actually 8 to back of the skull all the way down to the top of the shoulders. Adjust there to move things around left and right over time by doing a quick cavitation left and right. If you want to move better, you might hear something, but goals can cause more motion. Look at the constriction to make the motion stay better. Right? Take a look back for me. So right here.
Simple stuff. Simple.
Have her, I'm going to have them turn your head to the right by kicking that down, expose that left side of the neck for me to move these areas. I'm going to use this part of my hand right here to cause that contact with the bones of the spine. If your shoulders are relaxed, she's breathing normally, she's not tensing up on me. That when I get in here, take a deep breath in, all the way out, right here, move that bone just like that. Okay, we'll turn around on the side too. So make sure she's breathing normally, nice and relaxed. Shoulders relaxed, most not keeping tension. Hold it right there, take a deep breath in, all the way out, right there. That allows the bones to move normally, a very quick motion, but a very limited motion, so you're not going to rip the neck off. So most don't want to
Don't rip the neck off. I did, yeah. Piece of cake, easy. All right. We'll do that in a second. So as you saw, it's how do you explain to the general public in normal, common language what chiropractic is? Everyone has their own spiel, whatever you want to say. But did I use any 3-syllable words there? I don't think so. I don't remember any 3-syllable words in my language anymore. So by keeping things as simple as possible, as short as possible, allows them to absorb it a lot easier and understand what we're saying, understand the need. Then we go right into it. For me, right into it. Let's show you what it is, get it in there, and that points you the result. It's not that difficult, right? We do the mid back. We do the low back too. Let's do the low back one real quick. Nah, we'll skip that. There we go. Simple one.
Part of that low back spine, tailbone, hip joints,
So if you don't show the x-rays, it's kind of what I do. If someone doesn't want to take an x-ray, doesn't see anything, simple stuff. Like a lengthening quality type of thing. Simple stuff. Simple.
Now we're doing here. Here, it's a little dark on this side. I want to contact that same side across the back. Now drop that arm down.
You guys do a leg length check. Do you ever recheck again too? See how it looks? Simple, right? Confirms what you did.
More level, right? It won't stay here. Now, from this point on, now that we know what the problem is, what I would do after the adjustment, this part along with the back and neck, is now that you've exercised them, make things want to stay below. Our hips have learned, herniasis have learned to stay as per normal. You know, over time, down the line, as we coach you through the post-adjustment guidance, we can exercise neck and make these hips more level, so they stay this way.
So when someone has leg quality and you adjust them, see the results, how do we get it to stay there? What do you normally do? How would you verbalize that? What would be a good way to do that? Do you give them stretches to do? Stretches, strength exercises for 1, 2. And sometimes if they're off enough too, what I'll recommend is even keep it very, very simple. Don't have to go to the store and buy something crazy. Is take an old, say the shorter side off by 1/4 inch. I have them take an old insert of their shoe, put in their normal shoe to take that 1/4 inch and level things out. Let somebody yesterday come in, 79 years old. He has scoliosis. He's off about probably 1/2 inch, maybe 3/4 inch. So I told him, take 2 of them and even cut them if you need to, just the outsides fit in your shoe, and start with that first. Bad sciatica, a lot of back problems. So when someone comes in with chronic pain, you've seen a chiropractor before, has seen improvement, I want to give them something different. So having that extra thing that I want to call it homework allows them to say, hey, let's try to see what happens. When you give them homework, maybe stretching, maybe exercises, maybe go for a walk 10 minutes today, when they come back, what do they have to do? What in their head they have to do when they come back? When they see them a couple days from now, say a week from now, they're going to go, I'm going back on Tuesday. I have to make sure to do my stretches. Went for my walk. All right? Ever have kids? They go to the dentist every 6 months, especially with boys. Boys are the worst sometimes. They go, you're in dentist tomorrow. I better go brush my teeth tonight. You know? It's like, you should have brushed them the last 6 months, but you didn't. That's fine. You know? They want to make sure when they go back, they give you a good impression. Hey, I did my homework. Give me an A. Sometimes they go, I'm going to give you a thumbs down today. You know? So I want to make sure they have something to do to make their body feel better on their own. By doing that, what else are you doing when you give them homework? Are they also indirectly or maybe subconsciously start building habits they can do on their own every day to stay healthy? I send my patients, I'm technological, whatever it is, I send them videos to watch. This is how you stretch your back. Let's go over right now before you leave the room. This is how you stretch your back. This is how you stretch your neck, your shoulders, all the joints in the body. I'm going to send you a video to remind you. Open the video, send a response, say you got it. So you confirm that you actually saw the video, hopefully. You know? So I want to make sure they understand it's not me getting them better, it's their lifestyle over time getting them better. So they understand they have to maintain that. I tell my patients, I want to help them become their best doctor. Can we do that? So they understand, even if they're not seeing you, what questions to ask their next chiropractor if they move, even their medical doctor or their PT or their trainer, what else can I do? So you're almost training their mindset of how to ask questions versus just giving them the answers all the time. When we do that, it allows them, again, to become their best doctor, but also take your information and go, now I can do this, this, and this. Let's add more to my routine. If they already work out, are you going to help them work out better? Yes. You're going to make their symptoms go away, release the joint pressure, release subluxation so their body can actually heal. Now their workouts, I tell my patients, now the workouts actually will feel good. What happens when someone comes in, say, end of January, early February? What do you normally see? New Year's resolution people. After the gym. They didn't work out for 11 months, went back and tried to hit it hard, and now they can't move. They woke everything up. So I go, fantastic. Don't stop going. Let's back it off a little bit. And now let's get you moving around. So now we get things moving. Even when someone goes back to the gym too for a while, haven't gone for a while, what's going to happen? They're going to get sore, tight, uncomfortable, even grouchy. I tell them you have to do that to wake everything up so you know what's going on. Sometimes we have to let them stress their body to wake things up so we know what else is left in their spine to treat them or their hips or their knees or ankles, whatever it is, to get them overall better. All right? Isn't that our overall goal with the adjustment? Who wants to get treated today? Who wants their adjustment? Anybody? Good. Come on over. Give you my quick spiel. Do you guys have fun with your patients? Of course, yeah, you have to. I want to go to work and have fun. Tony, nice to meet you.
Hi, I'm Vicky.
Vicky, nice to meet you. You can go on, Vicky.
Just low back, I would say.
Okay, I'll move my camera a little bit just for here. I always shoot these videos, I put them on my YouTube for other doctors to see, my interns too, so they understand what we do. This is what I do. So more low back. Is it one more side or across the back completely?
It's more on one side, the
Good.
right.
Right side. Okay. So on your back for me first. On your back, face up. So again, as you just saw, ironically, so you are off just by a little bit. And right, I'm seeing here as I push your feet together, right side a little bit longer and left side a little bit shorter. How do you normally stretch your lower back? What do you do?
Straight leg raise.
Perfect.
Figure 4.
Good.
Um,
Anything go into extension? Okay. I tell my patients sometimes, this here may be your low back, yes, but also you might have a tight hip, or your SI joints might be off too, so we're going to adjust all at the same time. Okay, if I adjust everything, neck, mid, bad, low back?
Yes.
Give you the platinum package?
Yes.
Good. Let's do everything. So again, simple stuff right here. Vicky's not first day, not her first rodeo. Take a deep breath in, all the way out right here. Good. Bring your feet together for me. There we go. Good. Deep breath in, all the way out. Simple. Where do you practice, Doc? Where do you practice? Where do you practice?
In Real Mesa, down the street.
Close. You guys are close then. Cross arms free. And I do my thoracics this way. I have long arms, kind of goofy, but it allows me to move things around easy. And with my hand right here, and just lock it in like that with your spine. All right? And then deep breath in, all the way out. Get right here, all the way out. Do one more time. Deep breath in, all the way out. Good. And then, did you catch what I just said too? Every time I adjust someone, I always say good. That moved well. That cleared it out. So confirm to them, being a patient, he actually did what he's supposed to do. Sometimes what I'll do too is double check the neck or mid back the other way, and I'll tell them I'm going to double check to make sure everything's cleared out. If it doesn't pop again, don't be disappointed. Don't get mad at me, okay? So here, again, like I said in the video too, I always adjust the high side first. I'm going to have you go on your side facing this way for me on your shoulder and your hip. Vicky, perfect. Let that arm drop. Here we go. What I do too, you can't see on that side, I'll do it over here for a second. Stay there for 1 second. Stay over there. I put my leg on the table. So when I do this, does that help your lower back? Here, if I'm here adjusting someone, now there's a lot of back pressure. Especially if you're a tall guy, Ron. Like Ron. Ron's like 6'7", right? So here allows me to have pressure on my knee on the table versus on my back. So same thing, I'll do it over here. This one, Vicky, thanks for hanging out. Deep breath in, all the way up. Easy. Is that okay? Other side for me too. So here, same thing I'm going to do now is drop it to make sure I can correct that spine a little bit and go across the back to level things out. Deep breath in, all the way out. There we go. Simple. Good. So on your back for me, can I give you my stretch to make the hips more level?
Okay.
It's my secret one. Don't tell anyone, okay? So now, if my hips are here, let me check one more thing. Yeah, you're higher. Here, where I'm here, I'm exaggerating, right? Okay. I want to bring this side down and back versus up and in. So I tell my patients, you have a lengthening quality, it's not that you have shorter legs, you walk in a circle, it's almost your hips are rotated, making one go higher, one go lower. So I'll have someone do is bring the leg off the side here for me, and slide over just a little more for me because you're so tall. All right? Just saying. The leg drop all the way to the floor, open your toe, right there. How does that feel? Do you feel the stretch in the front or the back?
The back.
Perfect. So does this make sense? If I stretch my hip flexors, my quads, my psoas, get that hip to come in over time, that'll help reset my hips. They stay more level. Switch sides for me too. See how this side feels. Bring that foot back. But a little more. Come on. You have more flexibility than that. Perfect. How does that feel? Easy? More just the quad being tight? Easy. So that's the side we have to focus on. I tell my patients, someone has that, is do it for 1 minute, both sides. Just once, twice a day. If they work out, especially if they're a workout person or getting more active, I always tell them to stretch first, do your activity, and if need be, if you have any soreness or pain or neuropathy, ice after. All right, I'll show you one more. Is that okay? Good. All the way up. And now sit on the edge over here for me, on the edge. And then a little more there, perfect. Now come all the way on your back. Let your leg muscles relax, let your back muscles relax. As you're lying down, the muscles get out of the way. Now your spine can actually stretch the ligaments connecting the bones to decompress your spine. How does that feel?
Okay.
Perfect. I'll pay you later, okay, for all the positive answers. But I have someone do this, maybe start with 2 minutes, maybe add a minute every day, so their back can decompress, using the weight of their legs to get their back to more open up. Again, I don't want them to buy an inversion table or something else. Just keep things simple with your patients. All right, come on up. Thank you for all your help. Appreciate it. Simple things you can do. I call it the edge of the bed stretch. Pretty fancy, right? I'm not very creative. And again, I send the videos afterwards, hip flexor stretch, edge of bed stretch, and maybe even a wall posture check with them too. So you have something to take home and get later. What I'll do also, after I adjust them, that afternoon, if I saw them in the morning or that night before I leave or the next day, I'll call them or send them a text message. I hope you're still feeling good from your first visit. At that point, any questions at all, and did you receive the exercises? Why do you think that helps a patient feel like they're in the right place? And if you're female, that's I've got to kind of use your discretion for one too. But a text message is so much easier. I use my iPhone, what's it called, notepad, copy and paste, just change the name, hope if I remember, and just go. I have a little script. Hey, and what they'll do is text me back. Hey, thanks, doc. Appreciate checking in on me. I'm doing great. I'll see you in a couple days. Why is that follow-up sometimes important for someone? Because they spent the, go ahead.
More personable.
What's that? Yeah, more personable. What else?
Yeah. I mean, I think they just feel like they're feeling that they're being attended to. And
Yes.
they're feeling, valued and, like you heard them. And,
'Cause the first day for them may be chaotic. First time in chiropractor, had all this paperwork to do. They've had x-rays, not x-rays done, exam done. The first treatment's like, what the heck just happened to me? Had some exercises done. They did some table time, and then I left. Spent 45 minutes, I'm like, what just happened? It confirmed to them, like you had mentioned, now, okay, this is what's going on. This is what you're going through. Any questions you might have, let me know. Let me know as soon as you want. So it gives them ability to kind of take a deep breath and go, man, and again, do it gently, right? Be genuine with them that you're here to help them. What else can I do? So by having that rapport again, their next visit, they're going to come in and go, okay, I have a couple questions here and there. I don't want to ask you over text message, but can I go over those answers with you? I give everyone my back of my card, I'll show you at the very end, has my cell phone number on there. How many people call me? Nobody. I have no friends. No friends, especially patients. But allows them the ability to go, hey, if I need to, I'll text them if it's an emergency. Holiday weekends, what happens on holiday weekends? Johnny, who works at a desk all day, wants to go build a block wall in his backyard, right? He wants to build and when he builds a block wall, all of a sudden his back hurts. Oh, okay. So he may text you on a Monday holiday day and go, my back's killing me, what should I do? Perfect. Instead of going to the ER, which he might do, and spending 4 hours there, he'll call you, and what are you going to tell him? Put some ice on it. Lie down. Hire someone next time. Hire a contractor. Get it done the right way. I'll see you tomorrow. How many patients you've had in the past where they come in Monday morning and go, they get treated, they go, man, I should have come here first. And you go, why? I went to the ER this weekend, spent 4 hours there, gave me a bunch of meds, didn't work. Now I'm here, I was here for 10 minutes, and I feel better. I'm like, yeah, Johnny, do that next time. But it allows them that process of, you have contact with them, if need be, all the time, just to give them the confidence that they're doing the right thing, versus run to the ER or the urgent care, whatever they want to go. So having that availability, for me at least, and my staff, gets them the opportunity to tell what's going on with their body. All right? Any questions at all? Comments, concerns? Nothing yet? Okay. Here's some of the fun ones, I think. You always have fun patients, right? First treatment, you never know what's going to happen. I always have, if there's a spouse, this case, her dad, videotape them. Just, you never know what's going to happen.
I'll walk you through everything. You're right here. Deep breath in. All the way up. The head drops my hand. One reaction is that hurt me. That hurt me. Oh my God. I felt like I was just like on a ride at like Six Flags or something. Exactly.
Kind of time, good.
Oh, Jesus. It was very less. Oh my God. Oh my goodness. Deep breath in. And just go back to your back posture. Breath in again. Take your time. All the way up. Right. And one more time here. There you go. That's what I meant. Not as bad as the next one. Arm down your shoulder. Front kind of lower back. Good. One more breath in. All the way up. Oh. Good Lord. Good Lord. That's all cracking?
So what's going to happen, you don't know. First adjustment is always a surprise for everybody. Again, reactions, Tourette's, speaking in tongues, laughing, crying, you don't know. So having someone that allows them to see that video per se, or just for your own entertainment, allows them to feel less nervous about their first adjustment, their first treatment. I love to show my patients videos. They see them all the time. They come see me and go, hey, I saw your video and blah, blah, blah. I want to get that. And not that you want to hear the cracks all the time, but allows them to get excited about chiropractic. Like we talked about it before, the emotional response gets them to really buy into what we do. It may be funny, maybe something else too, but allows them to see that. Is that important to us and our patients? Have fun with it, you know? Everyone ever treat someone that's in a wheelchair? It's almost, you go in like a little more cautious. What's going on? Okay, let's help you. Don't be scared of that. I know some doctors that won't treat someone who has a bad spinal disc, a disc bulge. Not extrusion, not crazy, but a disc bulge to where, yeah, they have sciatica, but it's intermittent, it's not all the time, and they've had the MRI, and it's a 5 millimeter. Simple. You know, not very bad. It's or like maybe a 3 or a 2, whatever it is, too. No stenosis. So we go, okay, that clears us. Let's get you better. I had someone come in. He had pain since October, older gentleman, and his wife brought him in, and he goes, so-and-so said you helped him. Can you help me? I'm like, let's do a full exam first before I give you my yes or no. So giving that full exam done, I took x-rays on him too. He could stand a little bit. Bad low back, some arthritis, very minimal. Some disc-based loss, so 405, 05S1, but nothing too crazy. 2 months later, now he has 50% less pain, starting to move better. Instead of the heat, he's doing the ice pack. Do you guys recommend ice for neuropathy or more heat, or does it go 50-50 for you? What would you say? Heat? Good. Anybody else? I start with ice first and go to heat over time. But when someone comes in and go, they've been in pain all weekend and they've been doing heat the whole time and they have neuropathy, I go, and I feel their back go, they go, it feels really tender, sore. I go, let's go to the ice first. So if they're an existing patient, I'll put them on the table for 10 minutes or so with the ice pack and then come back and go, how does that feel now? Feel like it's calming itself down. When it's acute, I'll go, let's calm it down first and then we'll do the adjustment. Do you have to adjust someone every time they come in the door? No. For me at least. Sometimes they require a stretch, some therapy for 1, 2, maybe some acupressure, some other stretching too. But over time, if you feel, again, we all have our subconscious telling us, this is a kind of a red flag. Let's see what else we can do. I had someone come in a couple years ago, took x-rays, severe pain, but the biggest thing was red flag for me. He had not gone to the bathroom in 3 days. What does that tell you? Probably a sequestered disc, torn disc, L5S1, something like that. I said, here's your x-rays. ER's down the street, 3 blocks away. You're going right there. That night his girlfriend called me. He had surgery that night. So you have to use your own discretion sometimes to go, maybe this one isn't a chiropractic patient. Maybe some come in, fell off a ladder, broke his wrist. And go, here's your x-rays, go get it reset. And I can't help you here. So you have to be able to, sometimes, my staff said too, she's been there forever, make sure we protect us as much as help the patient. Do you have private rooms in your office, or do you have like an open door, open floor plan? What do you guys? I do more of a closed door or private rooms. That's me. When you're a patient, and for me it's more sometimes more the females, I'll leave the door open a little bit so people can see it from the outside just to be safe. Why is that important in, say, litigation? Right? We want to make sure they won't say something or say you did something when there's an open door like that. Because it's going to happen. If you've been practicing long enough, you'll get a letter in the mail, or a phone call, or someone leave a bad review. You know, they did this to me, whatever it is too. My staff was there the whole time. I have interns in my office from the local high school and college. They come in 3 days a week to help volunteer. So I have them come in the room with me. I always ask the patient first, especially if I know them, and go, they're just here to shadow and hold the chart for me. So again, simple, a way to diffuse any type of problems. Ever have, when you do adjustment for a patient, ever have a reaction where they did something to you after you adjusted them? I had someone a couple weeks, about a month ago. He big guy, does construction. I adjusted back for the first time really loud, and he jumped up and slapped me in the butt. Ever have that happen to you? Is that only me? Am I that special? No? Well, I had one person, he was a football player, bad concussions in high school and college, bad, he was nonverbal. His wife was his advocate. And I adjusted him first time, severe headaches, neck pain, obviously. I'm going to adjust him, but I'm going to see what I can help him with. Adjust him the first time, he was like, ugh. I said, okay, let's put some ice on it, let's calm it down. Second time, adjust him, he jumped up and wanted to fight me. So his wife stepped up and oh no, he's okay. I'm like, he's pretty big. I don't know if you've ever seen an old football player called Eddie George. He worked with Oilers back then. Back in the 90s, I think. Looked just like him, like 6'4", 6'5", 250. I'm like, I'll be over in the corner until you kind of not. She goes, next time I'll give him a bunch of medications before he comes. I'm like, maybe we'll hold off the next visit. So you gotta like be able to have your own little reactions of what happens. I don't know, maybe it's just me, maybe I'm just special. But having those reactions sometimes lets you know either it's like when they slapped me in the butt was more like, hey, she's funny. And when he did that, he was funny because he got up and goes, he was embarrassed, like, I don't know why I did that. I'm getting out of here. I got to go. I'll see you next visit. Just embarrassed for one. But those are just funny things that can happen to you in practice. Intern's like, does that happen often? Like, never. First time in 23 years. So we have to have ways to make sometimes, I guess, diffuse situation or laugh things off, right? You got to have fun with it, all right? Couple more of these are my favorite ones, I think. This one too, I think I have some more coming up, yeah. I had this by my front door. When you walk in, it's kind of, I have my patients read this on the way out their first visit. Okay, something very simple. Beneath every treatment or procedure, there is a life which is led by someone, person of dignity and worth, who is unique in the eyes of God. The task of physician, which is us, obviously, to cure occasionally, to relieve often, and to comfort always. Is that something that would be good for someone to read or feel or take a picture of on the way out? So you get, again, when they leave the office, I go, let me know if I did that next time I saw you. Did I help you this way? So again, not homework, but more of getting their head of what we're trying to do is really comfort always. When some people come to my office, they're not a chiropractic patient. So we help you resolve your issue, maybe with some exercise guidance, some icing, some stretching, something to get them to feel better. So this gives them the ability to let that sink in. We'll take the picture, read it on the way out. I have patients that when they're leaving, they'll stop by the front door and just pause, read, and they'll leave. Every time they come in. I'm like, it's not a cult, but it's something where that's just what they do. They want to make sure when they leave, they feel better. All right, so here's my next. I did this one a couple years ago, so I don't have any facial hair in this one. Still wearing my tie back in the day. Do you guys wear ties guys, do you guys wear ties anymore? No, kind of. How about lab coat? No more, right? No more. That's like old school, 80s, 90s, maybe? early 2000s. I work for a consultant for another business. That's a European device company. They do massage devices and other things too. So I have you do all these videos because they're Europeans, the stoic, behind a desk and with my fake glasses on. This is how we open this box for this product with my lab coat, my name. I had to dust it off, get it dry cleaned. I had to find it in the back of my closet. Like, we're going to do some videos. Like, okay, whatever. I'll do them for you. You pay me. You're fine. But that stays in my back of my closet now. Even my ties, I had like probably 10 years ago, like 40, 50 ties. Now I have like maybe 6 or 7. Funerals, weddings, and whatever else I got to go to. I don't know. I never know. So simple things. We treat kids, right? This is my normal Saturday back then when I were open Saturdays. Now I'm in the office Monday, Wednesday, Friday. Simple. I had a couple I'd met at a networking group back then. They wanted to do videos for chiropractic. They said, "Can we do a video in your office?" I'm like, "Sure, whatever." Came in on a Saturday, it set everything up for me.
I just feel like it's still a little tight. Yeah. I think that, yeah.
Just speeding it up. First timers. Ever get the leg pump when they're on their stomach? Little leg kick. So you got to watch where your body is, right? Get kicked in the back of the head. They're flexible. My staff's going, "Hurry up, we got people waiting out front." All right, whatever. They can wait. Richard. Yeah, stuff. Easy. It's a big one of the videographers. Again, reactions, you never know. Loud. Might as well. The foot trick.
So scary. I distract you with the feet.
It's dramatic, Ron. Very dramatic.
Yeah. Oh my God.
Little rib issue. Very loud leg kicks. You gotta have fun with it, right? You gotta have fun. Again, we treat all this stuff as we know. Sleep, headaches, stress, improved posture, pain relief, energy. And I think it's reading the room sometimes with the patient when you're ready to explain this to them, where they are in their overall healing process. So if it kind of, wherever your exam is, you keep it in your head, what they said, and go, now do you feel more energy? Now do you feel like there's less pain? Do you feel less stressed? Do you feel like if you lean forward, it feels bad versus this feels good to you now? How do you, when someone sits a lot for work, how do you reset their sitting posture? What do you do? How do you do that with a patient? What's your routine like? Do you have a system you do? So for example, I have someone here, sits for work all day. All right, here. So, have you come back real quick? Since you're standing already, might as well, you're already up. What's your name?
Shafana.
Shavana, Tony, nice to meet you. So grab a seat from like you would just like a normal slouchy person. Yeah, like that, perfect, right? And usually they're given ergonomics from the ergonomic department, a little stool for their feet to even sit even further back, right? That's so good for them. No, it's not. So what people do, they go, sit up for me first. Bring, like you are right there, scoot forward in the chair, scoot forward, right there. Now bring your feet underneath the chair, right there. So now your knees are below your hips. Now with your lower back, get your lower back to kind of scrunch up a little bit more too. Just like that. Hands right here. How does that feel?
It feels good.
Feels good, right?
Yeah.
A new patient would say, it kind of hurts my back. I go, well, good. This is normal posture for you. Knees below the hips allows now the hips to clear so you can rotate your hips forward to neutral. Your back can now contract like you're standing. Your shoulders will naturally drop backwards. Your chin comes back over your body versus in front, so you're in a more relaxed position. I tell them, let's make this your normal over time with the adjustments and setting your posture, and I'll send you the video. All right, Siobhan, thanks for all your help. Appreciate it. All right? So that's all it is really keeping things simple for a patient so they feel it, they see it, and they watch the video again to repeat that to them. So when they come back again, next visit, a couple visits from then, I'll trick them and go, hey, grab a seat for me to see how you sit. They go, oh, okay. So getting them to feel that and do that, remind them, making them accountable by asking them again to do it, allows to go, the doctor's actually paying attention. You know, by paying attention, they know they're there, again, you're there for their care, not just another patient. Simple, easy, all right? And what I did too with all these things versus the one about comfort always, that was in my office forever. I'm the 5th doctor in my office. I've been there since beginning of the office back in the 80s. These are more I found on Etsy, and I framed them. They're in each treatment room. Simple. Reminds them every day they come in the office. So yeah, you can put pictures up if you want. I just put these up so it reminds them what we do. All right, simple things. Hope you guys like this one. He was in a recent, you guys know it was NFL Draft Day Monday, football fans, whatever. He was in one of the commercials for that one. He was in a LinkedIn commercial recently. He was in a State Farm commercial last year. He was in the Netflix movie Running Point for a couple episodes too. So real good guy, just a little bit strange sometimes too. Sorry, it's loud.
Okay, wait.
And I have his wife filmed too, so
He's gonna get you ready, relax.
prevents my liability.
Honey, really, this is gonna be okay. Remember, it's gonna make you feel better.
I'm good. Oh God, will be so violent. That's a lot of pressure. Okay. That was really loud in your ear, probably. Yes.
See, I can't do this stuff for you, honey.
Okay.
This is why you made the appointment.
You didn't need it. That was the harder side, sir.
And remember, breathe, relax.
You take your breath in, all the way out. Put your hands together so.
People outside are like, what is going on in there?
How'd that go? Does that feel okay? It's exciting, right? But it feels okay.
Oh, well, exciting.
That's the hard part. I did that. We're done?
All right.
All over. Deep breath. I'm gonna fall. I got something. All the way out. Oh my God! Right here. Deep breath in, all the way out.
Yeah, I adjusted his wife first, and he ran out of the room. Took off. I'm like, can we videotape him afterwards? Please. Is he?
This is gonna be great when it's edited. So great.
Quick edit.
Then go ahead.
Hi. So dramatic.
Is that the one that I can't get?
Came in severe back pain too.
Stand up, Steve. Breath in. And all the way.
How you doing? How's your back feel?
Head still on.
It's so connected.
How's the pressure feel in the neck? Take that and go back.
Really?
Look how big he is. Doesn't fit through the door.
Keep it on your knees. And to lunge. Okay, that's good. We'll do it again. Oh, so you can practically put your palm down. Oh, there you go. Look at that. I'm telling you.
Just normal reaction to your body, that's all it is. Suppression.
Simple.
Thanks, doctor.
You never know what's going to happen the first time. It's so exciting, for me at least. Fun. Simple things. So again, another one I have in my office. Simple, right? Hippocrates. Looks well the spine for the cause of the disease. You know, people read these and go, "What does that mean?" So it kind of opens up the door for more questions. We get people to ask more questions what we do, because if you guys have kids, I have 4 as far as I know. All right, but at this point they're 22 and over. They're older now. I don't check their phone every day or call them every day. But when they call me, I know they need something. Guess what, Dad? I'm like, what happened now? Brakes don't work. Or I'm out of gas. Or there's an emoji on my dashboard somewhere. Sucks. But by then coming to me with questions of what's going on, now they're going to listen, right? They're going to listen to what you're going to tell them to do this, this, and this, versus, hey, don't forget this, don't forget this, don't forget this. When you keep reminding them of stuff, what happens? It goes in one ear and comes out the other one. So having patients come with your questions, Doc, what about this, this, and this? Or what else can I do for my back pain? I go, now I got you for the next exercise. How much do you walk? None. Let's start you walking. Let's check your walking posture first. Check your wall posture. Let's start walking that way better. I have a lot of senior patients also I see. Again, they come in. When someone comes in as a senior, have they had, usually by 7 years old, they had a surgery, a pain that's been there for a long time. Do they walk normal? I want to say ideal, if you want to call it that. Probably not. So I tell my patients that don't walk normal. They come to my office, I go, I don't want to hear you walking in my office. I don't want you stomping. I don't want you sliding your feet. I want you walking heel to toe. So at that point, your body gets better and feels better. So sometimes when someone's walked because of a pain or soreness or a surgery for a long time, that's their normal. So can we change it over time? So if someone's walking better, does it help their knee, their back, their hip, their neck, their shoulders? So long term, they go, I had one patient, was it James, he goes, I go in the room like, hey, did you hear me walk in the office? I'm like, no, I didn't know you were here. Like a ninja, you snuck in. Just joking with him, obviously. Because he was making sure, because he was a foot slider. You know, so we get them to know that you're paying attention. They go, did you hear me, Doc? I'm like, no, I think you just came through the window because I didn't hear you go to the door. I had no idea what happened. So having that ability to help someone, again, maybe not just for their back pain, but their overall lifestyle, gets them to feel better, and then be a long-time, lifetime patient. When someone comes in your office for a while, they start getting better and feel better. They feel looser. Also, they feel stronger. Why is strength important in chiropractic for someone's life? When someone's stronger, what happens? Then their pain can't come back. They've learned now they can handle more load in their body, handle more stress, and maintain their routine. May it be light weights at home, may it be walking, may it be weights at the gym. Now they know that's helping them get better. I don't want to see someone forever. I don't like people very much, as you can probably tell. But I want them to feel better, so at that point they maintain certain things that help them get there, and then maintain that for the rest of their life. I'll tell, for example, a kid 20 years old, I go, are you still invincible? If they say yes, I go, don't do any stretches. You'll be fine. Drink your Red Bull. Eat your hot dog from 7-Eleven. It's up to you, McDonald's, whatever you eat. Go for it. They start going like, you know what, doc? I've had this pain for a long time. It's not going away. I think I'm no longer invincible. I go, great. Now start some stretches. Okay, let's do something to change your lifestyle. You're no longer invincible, even though you never were. You just thought you were in your head, as we all did when we were younger. At that point, let's do something different that you haven't done in the past, help you get better and stay better. When I show someone a stretch, and Vicky, you're good at this too, is sometimes they'll go, ugh, that kind of hurts. I go, does it hurt or is it uncomfortable? If it hurts, are you guarded when you do that stretch? You feel like you have to kind of, a reflex where you want to tighten up more. They go, no, it kind of just feels like it's uncomfortable then. Okay, good. That's how far I want you to push that stretch. I want you to feel uncomfortable. Because that tells me if you're uncomfortable there, once you feel looser, then now become your comfort level. Some people don't realize they've been in pain for so long, as we know, docs. They've been in pain so long, now they're sensitive to pain. Sensitive pain, you don't want to cause more pain. Because of that, now we want to let them know that's a good uncomfortableness, not pain. Differentiating that for them, changing that in their head, they go, oh, that's going to get me better? Perfect, let's start doing that more. So maybe that stretch you can do for maybe 30 seconds and it gets painful. Let's just do it for 15, 20 seconds. Over time, let's add more time to your stretches as you feel better. So again, that better word, right? Can we get someone to feel better by doing things with you in the office, but also things at home? Is that helpful for a patient? To go, as their pain decreases, now they go, I want to feel uncomfortable so I get more flexibility. I want to feel uncomfortable so I feel stronger. I want to feel uncomfortable so I can sleep better, feel more relaxed. And does it help the nervous system over time reset itself? We're not going to handle more stress. Ever have a patient come in your office and go, my medical doctor told me to quit my job because it was too stressful for me. You ever get that? The doctor goes, or a doctor will tell your patient, well, because your family's so stressful, just leave your family. Dumb. You know, if I quit my job, who's going to pay my bills? You know, who's going to pay my taxes, especially in California? Get hammered out here. You know, but can we make sure we're not that type of doctor who go, let's make your body handle more stress by doing the right things before and after work, for example, so your body doesn't feel like it's being stressed out all the time. If you do it long enough, that I've done a lot of my own podcasts, I do. And I've interviewed a lot of chiropractors, trainers, psychologists, therapists, whatever. And as we know, how long does it take someone to change their physiology? What's it take? A week? 6 years? 5 months? What's a good range, do you think? 2 weeks? 3 months? Who's in the 3-month window? Anybody else?
11 days.
Yeah, how many?
11.
11. But they change physiology though, if they've been in chronic pain.
Physiology. Behavior, I heard 11 days.
11, it depends how dedicated you are too, right? But 3 months is enough time for under consistent habit changing that allows your physiology to change to a better state of health, neurologically, physiologically, and hormonally, right? Have you heard that before? You know, I don't know. But it seems like a good range. So I tell someone, yeah, you're feeling better. Let's change your physiology in 3 months. I'm not going to see you every day, but enough time for your body to change. So maintain these habits every day so your body can actually make that your normal. How often should we have our patients stretch, you think? Or how often should we stretch as humans, human beings? What do you think? Every day. I tell my patients, stretch the days that end with Y. Which days end with Y?
Every day.
Every day. Younger patients take a little more time. They go, I'll give you a minute, give you a second. Time. And I do a senior talk every month at my local senior center. I tell people that have been there, they're my cult following. They're there every month. Go, how often should we stretch, guys and girls? Every day, doc. Or days end with Y. Okay, good. So I want to make sure I get in their head all the time. By having that routine with them, adding more to the routine over time, along with the adjustment too, they're going to feel better. If they feel better, what happens is they maintain a better state of health. And when someone gets better, do they go, okay, doc, see you never? Do they ever say that? They say, I'll see you when I have this. Because what I do, I tell them exactly what they should feel to come back in. You guys ever deal with your patients? Someone who has, for example, hand tingling when they first came in, gotten better, feel great. I go, when you start feeling that come back again, wait about a day or so, 2 days, then call me and see me. I want them to become their best doctor. So I want them to know how to not diagnose themselves, but know what the symptoms are coming back, to know it's their neck injury or their neck problem before, maybe scar tissue or arthritis, causing their problem. I said, I want to see where it happens. I don't want to over-treat you again because of the same issue. I said, I'm too busy as it is. I don't even like you that much. No. But can we do that to give them a sense of, when do I come back? If you leave that ambiguous or vague, what happens? They go, well, what happens is they'll come back 3 months after they had a problem and go, it's been hurting again. How long? 3 months. I'm like, why did you wait so long? They say it unconsciously or subconsciously or to them directly. When someone's a patient for a while, they should be able to know when to come back, I think. So you guide them and go, this is your guidelines. When this happens, boom, see me right away. Yeah, I have, let's say, UPS patients from before too. More than 3 days, they're lifting boxes all day. At that point, more than even 2 days, depends on who they are, see me right away. You know? At that point they know, okay, I got to get in there. Simple stuff. Now, Claudia. Every time she comes in. Every time. Takes like 10 minutes to treat her. 10 minutes. Every time. Full cackle, I think it's called. Easy stuff. Every time. Every time. Every time. When someone laughs or smiles, what's a common unconscious reaction to that? Smile back. And you hear a laugh, you normally just laugh under your breath maybe. So how often do we smile at our patients? Just to say hi, hey, what's going on? How are things? You know, hi, what's going on? Or a new patient too. That allows them to feel that relief. I do a lot of talks for medical assistant programs through the RP program locally. I do their commencement every year. I skipped last because I was busy. A lot of it, I tell them two things. If you're going to be in healthcare, you have to be able to smile and be able to communicate with your patients. If you want to enjoy being in healthcare. Some people we know that don't enjoy being in healthcare. They come in an office. I did it with my financial advisor a couple weeks ago. Real nice guy, but I come in, I want one thing done. Here they go. Tell me his whole life story and this. I'm like, I just wanted one thing. Talk to staff after. Jennifer goes, I know, he talks a lot. You know, it's like, I just want to do one thing. When someone types on your problems, like, it just brings you down. They're in your office with problems already. They don't want to hear your problems, I think. They just want to know, can you help me? Can you help, make them feel comfortable? That's all it is. You know, and when I come to my office every Monday, I go, I reset my brain, okay, weekend, blah, 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 whatever happened, let's take care of people today. And enjoy being with them. And if you remember, like, Johnny's aunt was in the hospital. Yeah, come to Monday morning, hey, how's your aunt doing? How's this going with your life? How's the kids doing? I had one guy, Abraham, comes in the office and goes, hey, I named my son after you. I'm like, that's so awesome. His wife already picked it out earlier. But I appreciate the compliment. You know? It's something where, and I go, hey, how's Anthony doing? Is he sleeping more than 4 hours now? Is he teething yet? When you have that rapport with patients, when you keep that file in your head, it just makes it, if you enjoy it, you have to enjoy it, obviously. At that point, it allows that to make it as personal as possible. You know, or they'll ask you, hey, doc, how's your day going? You know what? Thanks for asking. Great, because you showed up today. You know? It's something to where you have to be able to, I guess enjoy what you do, whatever it is. So here, it's been in my office again forever, like the other thing too. Even if it isn't your best day of your life, why not pretend? Could you help patients change their perception? Whatever they listen to on the news on the way here, whatever happened in their life, their car broke down, they've got a flat tire, or one of the kids has an emoji in their dashboard, they don't know what it is, they call you on it, and it's, oh, it has been changed in 6 months. Why not? I don't know. But something where you go, why didn't you change it? Just tell me what it is. At that point, come in the office. By doing that, it changes their mindset of, okay, let's get you better, and let's get you to feel we can cause change in your body. Health is not just physical, right? It's mindset, not psychology, mindset, emotions, for one too. Can we help someone change their mindset when they walk in the office? I had someone come in, well, back, a real nice lady, comes in, and she's my partner, she was on vacation. I saw her, she goes, I got this going on, this going on. Oh my God, this going on. I'm like, well, at least your hair looks good. You know? I go, all right, thanks, lie down, let's get treated. Bye. You know? She goes, what do you mean? Your hair looks good. Good job. Didn't you say you went to the salon today? Yeah, it looks good. Ever have a patient tell you, I have a lot of neck pain, but can you adjust my neck without popping it? I go, I can use an activator. I don't like the activator. Then I don't know how to help you. Maybe some stretching, maybe. But I almost want to make sure we're doing the right thing for the patient, even though the patient might be scared of what it might be. Somebody set that person up seated and go, let's do a quick light one and see how you feel with that. Because they may have had what before? A bad experience. How many people have called your office and go, I had to see a chiropractor. My last one was horrible. He hurt me, blah, 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 blah. And you go, great, this will be a great patient. You know, we got fantastic. Someone had a bad hamburger, they want to come back to my burger place instead. Like, great, it's fantastic. So you have to, almost like, I use that situation and go, I want to see other cards. Why was that a bad experience? What did the chiropractor, what they did wrong? What did the chiropractor do to make it a bad experience for you? And make sure you don't do the same thing. I had someone come in earlier, he's from East Coast, but he's moved out here with his family for work. He saw a chiropractor one street down, or one city over, sorry, and his neck's been jacked up ever since for like 4 or 5 months. First day I treat him, first day I see him, I take x-rays first, and I look at his neck, set things up, give some stretches, don't even adjust it. Ice table, do this at home. Next time I see you, let's see if we want to adjust it or not. Because he came in and go, is it going to hurt from adjusting? I'm like, I'm not going to adjust you today. Because he came in like, I want some x-rays done, I want to see what it is. Let's just do that today. Taking a step back allows him to go, how is this person different? What are they doing differently to help me without even adjusting my neck? Second day he came in, I adjusted the crap out of his neck. Easy, mid back too. Because he was comfortable then. It wasn't just lie down, adjust me, and get out. You know, sometimes they want that extra questions answered, I think, to make them feel comfortable with you, to build that trust. Right? We have to, every patient's different. That's what I love about it, because you can't walk into a room with, I'm going to treat this person the same as I did last person. You have no idea. You have to have that open mind, I think, for all of us sometimes. All right, again, the spine, easy stuff. Here's Mr. Jack. Again, a very emotional person. You get those all the time. I had one more, didn't I? head back distraction.
And bend your fingers right there. I wasn't able to do this yesterday. Then keep your knees up. My knees up? But relax the back. Now cross your arms. Oh, man.
Oh no. Give me a second.
Relax. Same side? Yeah.
It's like a.
Lock
Is it normal?
Yeah, yeah. So the more you get better. Does that feel different, the same?
I feel relieved.
Yeah.
I feel, I think I'm still gonna.
It's gonna be muscle
Okay.
spasm, but not the,
Uh-huh.
the nerve calms down, the muscle relaxes, now the muscle needs time to heal.
So when I pick this one up, I'm good. When I pick it, I'm good.
That's gonna stabilize your left side.
Okay.
So your job today is focus on some stretching, I see it feels good.
Yeah.
You realize this is tomorrow morning, you have control all 100%. You had this one bulge your while you had that sharp pain. Now it's calming down, now we're not getting to where the spine doesn't unlock completely, so you can get that kind of cycle. So just happens to take care of everybody.
Easy stuff.
Yeah.
I was able to sleep today a little better.
Yeah, and Jack he's a funny guy. His wife has my cell phone number. Jack is very sensitive to pain. He will run the ER for every little thing. So she'll go, Jack, don't get in the car yet. Let me call Dr. Tony and check with him first. And I'll go, Jack, the same problem you had a month ago. I've seen you for a month. You did some other stuff, did some different workouts for 1, 2. At that point, I'll see you tomorrow. Jack goes, okay. And what happens? The wife stays 4 hours in the ER getting medication it doesn't need. You know, it's something to where have that available accessibility allows the patient and obviously his spouse to calm the stress level down. When a patient says, what if, a lot, how do you respond? You know, if someone says, well, how about this? What about this? What about this? I go, take a breath. Those are all possibilities. Let me figure out how to help the first what if. At that point, let's focus on that one. We'll go one at a time. Because sometimes someone just wants to not be anxious, but just go through all the rabbit holes of what they saw on Google, right? Or Yahoo or AOL. Is AOL still around? It is? Wow. I had a patient who had an AOL account a couple months ago. Go, you're keeping them in business. You know, keeping them alive. You know, change it to Gmail or something. I don't know. But having that.
The OG.
It is the OG. I'll give you that one for sure. This is the classic before Apple or something like that. But when you start having someone ask a lot of questions of what if or should I do this or how about this, or I like the classic one is when they say, they say, I go, who's they say? My friend Sally who had a chiropractor 10 years ago, they say this. I'm like, well, first of all, I don't know who Sally is and what her problems were, but let me help you with your problems now. So almost like you want to bring them back to reality somewhat of what's going on with their life right now versus everyone around them may give them full advice, but maybe not what they're doing with right now. You know, it's chiropractic, as we know, is not that hard. It's just we have to communicate it well, I think, with our patients, and they understand. Once they understand, what happens is now that branch goes to their family, friends, local neighbors, coworkers, whatever it might be. Do all of you look at what's going on? Do you have social media with your stuff? Do you do like Facebook, Instagram, YouTube, Google reviews, Yelp reviews, something like that? Anybody else besides me? You have to. People want to know who you are before they see you, right? Maybe if a personal referral, maybe, yeah. But if they see that you have a bunch of reviews on Google or Yelp that are bad reviews, how does that reflect on you? I have people that always want to market my practice. They'll give me 40 new patients in 2 days. Get those phone calls or those messages or emails or whatever it is too. I go, great. They ask me, how come you always have 5-star reviews on all your review sites? I go, because they know where everyone lives. They're my patients. I have their address on file. I'll find them if they don't give me a 5-star review, right? Again, and it come with somewhat joking manner. I had someone a while back. I left the 1-star review on a Sunday, 1-star review. I go, who is this guy? So it was a long, long review. The chiropractor did this. I told him I didn't want x-rays. He still gave me x-rays. He did this. He saw me on this. I go, wait a second. I looked at his last part. He goes, so don't go to this office. And it was like in Columbus, Ohio somewhere. I'm in Upland, California. So I screenshot the review, and I messaged him back on that Sunday because I get notifications on my phone. I go, hey, I think you got the wrong office. Apologize. He deleted it right away. I'm like, perfect. I screenshot it, so I had it on my phone. Come in Monday morning from our Monday morning office quick staff meeting for 1, 2 in the morning, or actually do it at lunch. So in the morning I came in and told the staff, hey, we had a 1-star review. I'm kind of upset. So we'll talk about it at lunch. They're asking me, who is it? I'm like, I will go over at lunch. Not going to tell anyone. Go over at lunch. So I go, lunch comes around. I see the reading. They go, that's not us. That's not us. I go, yeah, but it could be. We have to be on our toes all the time. And we can't take what we do for granted, I think. That's the best way to put it. We have to make sure we're being on top of everything we do all the time and setting a high standard, right, for ourselves. Whatever we want people to see is our reputation. And we want to make sure our reputation stays at a high level all the time. Is that important to you? I'll be a practitioner for at least another 10 years so I can retire, collect Social Security if it's still there. That's the plan. But can we make sure that we have that, even if you're not there, you're still seeing things that can sometimes go wrong. I have phenomenal staff. She's been there forever. She was there since she was 18 years old. She's 50-something now. She's getting there. I asked her a couple weeks, when we moved her office last year, we did an upgrade location, and asked her, when do you want to retire? She goes, when you wheel me out of here. I'm like, good, thank you. Because she runs my show. I don't do my own paperwork. She has all the insurance stuff. I kind of just sign stuff and let her know what's going on. She checks with me, okay, good. But a lot of it is when you have that, I guess, flexibility allows you just to see people. You know, I enjoy that. And she's my watchdog for the office too. If something goes not going right, she goes, hey, the staff is doing her thing. Cool, do you want me to fire or do you want to fire? How often have you had to fire staff? Anybody? I do it all the time. Not all the time, but I'm the firer of my office. I'm the bad guy. That's what I do. Not that I enjoy it, but it's something where when someone hasn't set a standard for your office or your company or your business, what happens is a reflection of you. You can control that. If they've done, I want to say more than 2-3 things, after even 60, 90 days, you know who the person is. I know some doctors have had staff forever that are not good, but they're just not willing to let them go. They don't have, I guess, the courage, whatever it is, because they don't understand it. People are not seeing you not because of you, the doctor, because of your staff. I'd never want that to happen. I had one person, she was a massage therapist in my office, when we did massage in my office, would show up late. We'd have a whole schedule for her to do. We had maybe 7-8 patients for that afternoon. It's for us, it's complimentary office. We just do it as a complimentary service for the office. Wouldn't show up, or call last minute, I don't feel good. That's nice, whatever. They started asking for extra tip. I go, well, that's a no-no. So I brought in a Saturday, and I said, hey, I need your keys. I'm letting you go. She goes, well, why? Well, you're running late, you don't show up sometimes, and you're asking for extra tips. She goes, well, if I knew I'd get fired for doing that, I would have not done that. I'm like, yes. No tears, just leave. Some people just don't know or don't care. And if someone is that your first impression for your new patients, existing patients, then what happens? That's a reflection of you. What's the most important, different topic, important word for anyone ever? What's your favorite word you want to hear, I guess? What makes you more aware? Is it your name? So if someone says, hey, Ron, in a crowd, Ron goes, does that ask about me? What's going on? So with that, when your patient walks in the door, does your staff know your patient's names? Are they that caring, if you want to call it that, seen them for a while, to know their name? Do you know your patient's names? I know most of them, you know, the ones that left impression with me. When you say their name, they take it personal. A new patient, I'll say their name probably 15, 20 times their first day to get in my thick skull what their name is to that person. But by saying, and the same thing with my medical interns and my interns in my office, I want them before they leave to tell me everyone they saw that afternoon or that morning. I go, don't look at your paperwork. Do you remember their name in your head? And they go, either I'll give them this or give them this. Go, see you next time. You know? But it's important to me for them as an intern to realize bedside manner is just not doing this. It's how you communicate that. When you think about that, they understand over time, the intern does, hey, how important is this person to this doctor, this office, even to them when they become their own medical professional. Some maybe want to become an MA, some want to become a nurse, sometimes chiropractors, God forbid, more chiropractors out there. But a lot of it is, can we get them to understand with bedside manner, someone's name is the most important word to them. And saying it right too, right? Sometimes I'll see a name and go, I don't want to mess this one up. So I go, first time I see them, I go, tell me how you want me to say your name. Repeat it again, 10, 15 times in my head, even to them, so it gets through my thick skull. Is that kind of something you guys do too? I went to Ron McDonald golf fundraiser down in Costa de Casa a couple years ago. And one of the program directors there, he knew everybody's name by the end of the day. Anyone who won a prize, it was like it was a bidding thing, open bid and closed bid. He'd say, hey, Johnny, good luck, or hey, Dr. Tony, good luck with your chiropractic practice. You won this. I'm like, dang it. You know? So he was very good at that. And he does very well too because of that also. When you be that precise, it's amazing how many doors open for you. How many people feel taken care of professionally and personally. You know, when we think about that, we can really enjoy our practice, I think, and make it part of our life. You know, I said I worked, when I first started practice, I worked 6 days a week, loved it, worked Saturdays, fantastic. Now I work 3 days a week, and I still love it. I do other, like I said before, consulting stuff too, I do on the side, but I just like what I do. These are also fun for me. But again, I think that when we think about it, how do we pay it forward to the next generation of chiropractors or anyone in healthcare? I went to my talk last week in Orange County. There was a lady there, chiropractor, who did interns from Southern California University of Health Sciences in Whittier, and she had him come in and just volunteer. She did a full rehab center where you come in, if you're an athlete, they do an exam first, golfer, you check your swing, they want to know how your range of motion is, and then have the interns do the therapies on them. Even some stretching, and she would do most of the adjusting. And with that, allowed them to see how an office worked properly. When you came out of school, did you run to a practice right away, or did you go and volunteer, intern, or become not a preceptor, but a associate? You know, everyone had their own little path. For myself, after the first semester of 10 semesters, I went and got the alumni page, and you guys are about my age. I took the yellow pages. Remember the yellow pages back then? Yellow pages back in the day? The classic? Ask my younger generation of patients and interns, yellow pages, they go, what are you talking about, doc? Go, never mind, look it up on Google. Google it. But something when you have that combination, alumni list, yellow pages, they go, who are the best doctors in my area? That's all we had back then in the late 90s or mid 90s was yellow pages and alumnus. So at that point, there's no real internet or reviews. So at that point, I volunteered starting my second semester. By the time I graduated, I knew where I wanted to work and be an intern and also be an associate for 2 years, and I bought in my practice here. But when you have that long-term perspective of finding someone that's going to help you and mentor you, and at that point get to where you are now, wouldn't you want to pay it forward to somebody else? And when I did that comparison, I visited about probably 10 doctors. Actually, I called 10 doctors. About 4 said, no, I'm too busy. I don't want to see you. I'm like, whatever. Next 6, I went and volunteered a little bit. I'm like, a couple I don't want to be there. No, not going to happen. About 3 of them I said, that's pretty cool. It's almost finding someone, being a student, that's willing to help you. You know they're going to help. They're there for the profession, not just to make money or do what they want to do. So being you doctors, my thing is always paying it forward to the next person. Helping the next person who calls, intern goes, hey, I'm going to graduate in school in a couple years from chiropractic school. Can I come and volunteer? Can I answer some questions for you? I go, I always say, fantastic. They go, do you want to know who I am? Like, I don't really care. Come and hang out for a couple hours if you want to, volunteer, just look professional. At that point, come in and just shadow. Can we do that for more interns, maybe even not in chiropractic school, just people that are in healthcare, even our patients that have kids who want to get into healthcare, just to get them a good, hopefully good taste of what a good doctor-patient relationship actually is, versus going to a medical doctor and going, I don't want to do that. And maybe not just become a chiropractor, but just be good in healthcare. Be good to people and really care what they do. All right? So, a couple more things, not a lot of stuff left here. This is if I have a podcast, Crooked Spine Show, get it, Crooked Spine Show? And this is what I do. I've interviewed chiropractors, anyone in healthcare for 1, 2. I've interviewed 7 chiropractors, 3 this last year from these talks. Either chiropractors have been in business for a long time or had even their own book too. How many people have a book on chiropractic? Anybody? I'm not a good writer, so I won't be writing a book. Maybe an audio book, maybe. But something where someone has it, I want to help them promote their field of practice. One, Dr. Verzal in Orange County, or Luga he does focus on headaches. Dr. Kripp in the Midwest, he's a younger doctor, great guy, talks about the truth of health. And Dr. Azario, I think, in more Orange County too. A couple of doctors, more senior doctors, been around for a long time. Dr. Byrne in Upland, my local guy, he wants a sales practice to interview with him. Real good guy. He's almost like what I want to be. He's in his mid-70s, healthy guy, still power lifts. But he wants to retire. His wife retired 2 years ago from airlines. He wants to go travel with her now. How many doctors don't take care of themselves so they get hurt in practice? Yeah. I know more than I want to know. That have had an injury, shoulder, wrist, hip, low back, neck, anything, neuropathy also. Now they can't practice anymore. Or they have to hire associates just to be able to practice with them, keep their doors open. I had one guy, younger guy, good guy, Dr. Eric. He started playing pickleball. How many of you seen pickleball injuries in your office? I love pickleball, job security. Love them. He had his own practice, still does. He ruptured his Achilles in a boot for 6 months. Had to hire someone to run his practice, pay him so he would get covered. So having a healthy lifestyle as a chiropractor for yourself, would that increase your longevity to be in chiropractic for a long time? How many of you guys stretch every day? I do. Have to. I don't like rigor mortis. How many of you get rigor mortis in the morning when you wake up? I do. Feels tight, sore, comfortable. Stretch, go work out. Lift weights, stay strong. Flexibility is huge. Have you ever suffered from a shoulder injury before? I had one first semester in chiropractic school, tore my pec. Fantastic, good choice. But again, recovered, thank God. So I'm still here. But having injuries sometimes lets you rehab them over time and then pay that forward to the next patient. I said, I wouldn't lift that much weight, just stretch first. Focus on stretching first and then lift more weight. So getting that balance of someone to understand if they're not invincible, the balance of flexibility and strength allows them to go, oh, that makes sense. But giving them time too. Last thing here, this is all my information. Again, thank you for listening to me spiel with you guys for a while for one. Again, this is just my Instagram, Facebook, YouTube, podcast, everything I do. If you want to contact me being on my show, let me know, not a big deal. It's free, obviously. We do it through Zoom, or I use StreamYard sometimes also, and we have about half an hour. I like people to promote what they do, because when you do that, it almost reaffirms yourself what you're doing is the right thing. That makes sense? The more you talk about it, the more you reaffirm for yourself you're doing the right thing. It's your truth, as Dr. Crippen says in his book in my podcast interview with him. So that's all I got for you guys. Anything else? Questions, comments, concerns? Was that okay? You weren't too bored, hopefully, Ron? It's okay? I do these talks for one too. I do workshops for the schools too. I think if we make things fun, entertaining, educational somewhat too, allows people to absorb the information better. Sometimes you go to talk to and you're like, I wish I had a hat so I can just take a nap right now. But when you make it fun, it allows people to be entertained, and they, as we know, listen, and actually they get something out of it. So I hope you got something out of today. All right. Enjoy your San Diegoan days and your lunch. Anything else? Good? All right. Have a good day. Bye-bye. See ya. All right. Enjoy. I think she said an hour lunch break. Hour? 1:30. 1:30? Okay. Yeah, I'm done, yeah. I need more slides the next time. I put more slides next time. I need more slides next time. The next one. I'll add some more slides. All right. Yeah, we're good.